Did you know that within the first year of having your teeth pulled, 25% of your jawbone density is lost? Hi, I'm Chris from Nuvia Dental Implant Centers, and this week I'll show you what happens to your jawbone when your teeth are pulled out and how one patient found this out the hard way. Here's an example of what will happen to your jawbone after wearing dentures. This patient had dentures for over 15 years. Look at how much bone has deteriorated. Now compare that to a healthy CT scan. The teeth and jawbone are nearly perfect. It's really amazing at just how fast the bone can recede. This is a perfect example of what will happen to your face if you decide to have your teeth pulled and get dentures. As you can see, the structure of the jaw and nose are severely compromised. The nose will begin to hook down and the lower jaw protrudes, causing you to look much older than you really are. Patients that have suffered through dentures for many years all have these common complaints. They feel very fake and unnatural. Dentures are constantly slipping and moving around, causing discomfort and embarrassment. Patients commonly complain because they will always have to re-glue in dentures. With dentures, chewing capacity is extremely limited. Even though the initial cost of dentures are less expensive than implants, due to the constant need for alignments, dentures can easily become the more expensive option in the long term. Here is Cindy. She suffered through dentures for quite a long time before she decided to get dental implants from Nuvia.
I was probably around just in my early 40s, and we had decided to make the leap to dentures. When you're having tooth extraction along with the dentures, it can be kind of expensive, and so we were looking into different options and what that would look like. We decided to go with the dentures to kind of fix the overall problem. There are so many complications that come with just dentures. They never fit completely right. Lots of glue, you're eating something and constantly having to excuse yourself to go re-glue your teeth because they're getting loose, and you're concerned about smiling or laughing. And I've had that actually happen to me before, where I was laughing really hard and my bottom plate kind of tilted up a little bit, and it was just really devastating to me at that time. So so dentures have been difficult, really difficult. You're constantly, once a year you have to go in and have hard relines done, which can be expensive, so sometimes you just don't do it, and it just causes overall problems. I didn't realize how quickly the bone can break down. I wish I had known how fast that can happen when I first had my teeth pulled and got dentures. I wish I would have known the repercussions of that, because it just changes everything. It changes your smile, it changes the shape of your face. You almost get to the point where you just don't recognize yourself anymore. I wish that I would have just spent the money at the time and had the implants put in and just went ahead and did it all at once. I would have been so much better for it. I think I would have been more comfortable in my skin. I wish I would have known about all of these and just waited a little bit of extra time and spent the money. It would have been a much better option. Just the freedom of it, because I'm not worrying anymore. I'm not worrying, am I gonna laugh? Are they gonna slip? Am I gonna be eating and somebody's gonna notice? Am I gonna sneeze and they're gonna pop out of my mouth? You know what I mean? There are so many things you're constantly worried about, just a malfunction of some sort that is going to devastate you.
If you could go back like 6 months ago, what would you tell Cindy then?
Do it. If you're going to do it right. Don't think about the temporary solution, because the long-term solution, it's going to impact you. It is going to affect you. Do it right the first time. It is going to benefit you in so many more ways than if you just do this to get by for now. It's never going to be a get by for now. It's going to be a permanent situation that you could potentially be in for the rest of your life. It's not worth it to go down that road. Do it right the first time. That's all I can say. I wish I would have done it right the first time.
Many of our patients from Nuvia have had this to say about their dental implants. They look so much more realistic and feel natural in my mouth. Patients also love that the implants are fixed to their jawbone. All of the biting force is back with dental implants. You can eat steak, corn on the cob, and eat as many chewy candies as you'd like. The maintenance on implants is so simple. Brushing and flossing with a water pick is really all that's needed. No more need to remove and clean your dentures. Now, of course, the most important factor of all with dentures versus implants is that there is no need for realignment. All of the implants are permanent and stay in for life.
So when we have all of our teeth missing, the go-to for years and years and years have just been traditional dentures, which of course is an option where we replace our teeth and they can look good, they just tend not to function very well. And so that's why implants are a game changer. You're able to function so much better. Your biting force is so much greater when implants are involved. The removable option will increase it from what a normal denture would give you about 10%. The fixed option goes even higher, up to that 70 to 90% of function, and so a tremendous difference.
If you have missing teeth or dentures, stop the bone loss before it's too late.